for Lab 2 of spondylolisthesis, I wanted to think of a self stretch and a mechanical stretch that can be used for patients and for people who might have spondylolisthesis. Remember that our patient has grade 3 spondylolisthesis, meaning that their slippage of their lower lumbar is pretty significant. So for that, the self stretch that we decided to use comes from Summit Medical Group. It's a website that I use that actually offer a lot of really good information for stretching for people who may have spondylolisthesis. So the one that we're going to be talking about today is the gluteal stretch. You can do this laying on the ground, but I personally like doing it in a chair better, and I think that for a person with lower back situations and issues such as spondylolisthesis, this might actually be a better way of doing it. So take your leg and you put it over right over left or left over right, whichever one. You would do this both ways. You take your hand and put it here, and then you lean forward. You'll feel this down the back, your lower back, into your hamstrings, and all throughout your hips and your glutes. So this stretches your gluteal maximus, minimus, medius, as well as your hamstrings and some of your lower back muscles that we'll talk about it in a minute as well. It can be, I think it's such a good one because it uses and it stretches all of these, the biggest muscle groups around your hips and lower back, which we know is where spondylolisthesis really starts at. For the mechanical stretch now, it was really hard to find anything for a lower back other than the back brace. So that's kind of what I went with. A regular back brace, as we know, is used for better posture. It's used for better lifting mechanics, which is exactly what a lot of spondylolisthesis patients might actually need. Because bending over the wrong way, putting too much weight out forward while trying to lift can really significantly increase some injury due to that slippage of the lower spine. So having proper posture, having proper lifting mechanics, and really using that brace is almost like an interabdominal cast almost, can really help, I think, with keeping that spondylolisthesis from progressing. It helps the muscles. It kind of helps stabilize. Obviously, it's all your core muscles. So your iliopsoas, which runs down the back of your spine into the inside of your pelvis. Your quadratus lumbaris, which also attaches from your pelvis to your lower back, which is such a big muscle. I mean, it's a small muscle, but it's right around where spondylolisthesis usually actually begins to slip, as well as your lower longissimus and your rectus spinae, your spinaeus, and your iliocostals all kind of work as that posture group that keeps us up straight, where that back brace is really going to help keep those lower areas of those muscles stabilized and upright. So I hope that helps. If there's anything that I can clarify on, please let me know.